Hello, I'm Dr. Presh. Let me tell you about Mr. Raja, who was found unconscious in the snow. We'll walk through exactly how we treat hypothermia, step by step, using the UK Resuscitation Council guidelines. A passerby finds Mr. Raja lying on the ground, shivering and unresponsive. The emergency team arrives swiftly. First, I shout, "Help! Possible hypothermia," and ask a colleague to call the arrest team and note the time. I tell the team to gently lift Mr. Raja onto a stretcher and bring him inside a warm ambulance or building. Rough handling can cause the heart to stop, so we move him carefully. While we're moving, I inspect his airway, listen for breathing, and feel for a pulse. If he isn't breathing, we start CPR following the standard adult algorithm, but we keep him flat and avoid unnecessary movement. Once inside, I ask the nurse to cut off any wet clothing. Wet clothes pull heat away from the body. I instruct the team to cover Mr. Raja with dry blankets, a warm hat, and socks. We also place warm packs on his chest, neck, armpits, and groin, never on the limbs, because that can cause the cold blood to rush to the heart. The doctor orders a liter of warm, 40 degrees Celsius, normal saline through a large vein. I ask the nurse to start the IV and to keep the fluid warm. We use a low-reading thermometer to verify his core temperature. If it's below 35 degrees Celsius, we continue rewarming and watch the monitor for heart rhythm problems. If his temperature is very low, below 30 degrees Celsius, or he has no pulse, I tell the team to begin active external rewarming with a warm blanket or a forced air heating device, still following the UKRC guidelines. For very severe hypothermia, the team may prepare for warmed humidified oxygen or warmed gastric lavage, but this is done only in a hospital with specialist equipment. After 30 minutes of rewarming, we recheck his temperature, breathing, and pulse. If he starts to improve, we transfer him to the ward for careful observation. For patients in arrest, we start CPR and administer a maximum of up to 3 shocks without any drugs if the temperature is less than 30 degrees Celsius. Mechanical CPR is considered, and at temperatures above 30 degrees Celsius, with a shockable rhythm, shocks are resumed with adrenaline at twice the interval between doses. The indications for considering the termination of CPR include obvious signs of irreversible death, a valid DNR, avalanche burial greater than 60 minutes, airways packed with snow, asystole at presentation, conditions considered unsafe for rescuers, hope survival probability greater than or equal to 10, or an ICE score less than 12. Treating hypothermia is all about gentle, steady warmth and careful monitoring. All hands must be on deck to ensure the best outcomes. I am Dr. Presh, and I am here to make life precious again.